What does it really mean to be well, and who gets to define that? In this solo episode, I'll share my journey as a registered dietitian, stepping out of the hospital-based nutrition setting and into public health. We'll explore how health is often treated after something goes wrong, and how you don't have to buy expensive products or follow trends to be well. This episode is about realistic health, prevention, and meeting people where they are, not where social media says they should be.
Greenup County Health Department. Our legacy of health lives on. Greenup County Health Department. Public health is public wealth.
So currently I've been a dietitian for about 3 going on 4 years now. When I first started working as a dietitian, my role was in the clinical setting. I worked at a local hospital, and my role went beyond just handing out diet educations or just checking your boxes in a chart. Yes, I was assigning different diets to patients, but I also had a hand in formulating tube feeds, working in critical care settings like the ICU, and supporting people whose bodies were under an extreme amount of stress. I worked with patients who couldn't eat at all, where nutrition had to be delivered in different ways than just how we normally would on a day-to-day basis, just to help keep their bodies functioning. I worked alongside nurses, pharmacists, doctors, speech and occupational therapy, a whole entire care team, and I saw firsthand how nutrition plays a real clinical role in healing. I also work closely with radiation oncology, helping patients figure out how to get the nutrition they needed when eating could be extremely painful, exhausting, or could feel nearly impossible. When someone's appetite is gone or when taste changes, when swallowing hurts, nutrition really becomes survival and not just about wellness. And that's what I learned. Nutrition does matter when you're sick. It can support recovery. It works alongside medication and medical care. It's not optional in a clinical setting. It's essential. But working in the hospital also did show me a little bit of something else. Most of the people I was seeing didn't really end up there overnight. Their hospital stay was often the result of years of barriers. I'm talking limited access to care, limited nutrition education, food insecurity, chronic stress, or unmanaged conditions. And by the time we saw them at the hospital, our patients were reacting to preventable complications, delayed care, and needs that had gone unmet for far too long. I started asking myself, what if we could reach people sooner? What if nutrition support didn't really just stay in a hospital bed? And what if it started in the community and not just when it got critical enough that you had to be in the hospital? That question stayed with me, and it eventually pulled me towards the Greenup County Health Department, working in public health. Because as powerful as clinical nutrition is, prevention is even more powerful. Public health taught me that everyone's health journey looks very different. Not just a little different, fundamentally different. We don't all start at the same place, and heck, we aren't even running the same race. We don't all have the same tools. We don't all have the same Wi-Fi access. We don't all live on the same back roads. So comparison doesn't really make sense here. Comparing your health to someone else's doesn't motivate. It actually can make someone feel disconnected. Because while one person might be having the space to focus on their health, another person may just be trying to manage, survive, or just get through the week. And both are valid. Public health helped me understand that health isn't just about doing the most. It's not about going to the gym every day, making sure you're drinking a gallon of water every day. It's about doing what is realistic for you and your family, right now with the resources that you have. It also showed me just how much support already exists in our county. Places like the UK Extension Office, the Greenup Public Library, and even here at the Health Department. We aren't just buildings. We have people here that can help you. We're access points. We're places with education, support, and connection. And even if these facilities don't have exactly what someone needs, We always have something just as valuable, which is the right connections. We know who to get you connected with or where to point you to help you get your needs met. This is the side of health that we don't really talk about enough. Not the trends or the products, but the systems, the community, and the support that help people take that first step forward. So, what do I mean by not buying into the wellness industry? Now, let me be clear when I say this, especially in our community. There are wellness businesses here that are doing very good work. Many are locally owned, they're deeply invested in this community, and they genuinely care about helping people feel their best. This isn't about discrediting them or saying that they don't have value here. What I am talking about is this idea that health comes with a price tag, that you have to constantly buy something, subscribe to the newest trend, or follow something on social media to be doing health the right way. In rural areas, that message can feel especially heavy. Access looks different here. Time looks different. Transportation, income, internet, and availability all play a role. And when wellness is framed like something that you have to purchase, it can unintentionally leave people feeling like they're failing even before they start. Public health, on the other hand, teaches us that wellness should be accessible, not exclusive. That your health isn't defined by what you can afford, but by the support, education, and resources that are around you. You can take care of your health through community programs, preventative care, nutrition education, libraries, extension offices, and local health departments. You can take small, sustainable steps every day that fit into your life, not someone else's highlight reel. And if wellness products or services work for you and fit into your life, that's okay too. It's good because health isn't an all or nothing thing. The point is, wellness should feel supportive, not stressful, and you shouldn't feel like you have to buy your way into being healthy. If there's one thing I hope that you can take away from this episode, it's this. Health is not a one-size-fits-all, and it's not something that you have to earn your way into. Working in the hospital setting taught me how powerful nutrition and medical care can be when you're sick. Public health taught me how powerful prevention, education, and community support can be before things get to the point where you have to be in the hospital. Your health journey is your own. Your starting line is your starting line. We are not all on the same starting line. You don't have to compare it to anyone else's because, again, we're not all even running the same race. If you're in a season where you have the space to focus on your health, that's great. But if you're in the season where you're just trying to get through the day or week, that matters too, and both deserve support. If you're listening and thinking, maybe I could use a little support, please reach out to us. Whether that's calling here at the health department, stopping by the extension office, visiting your public library, or even just asking a question. All those first steps matter. One way that I want to challenge you guys to really take charge of your own health can be even just joining a free program that we're offering over the next 6 months in Greenup County. It's the Greenup County Health Department, the Greenup Public Library, UK King's Daughters, UK Extension Office, and Bodyworks of Russell, Kentucky. We are all partnering together to bring you a program called Grow Well Greenup. And so what Grow Well Greenup is a nutrition and physical activity program for all ages, all sizes, all capabilities. We're going to have, over the next 6 months, different opportunities to know your numbers. And what that means is really just getting an idea on what your health numbers are. So here at the health department, we'll have options to do free biometric screenings. And what that means is we'll just be checking your cholesterol, your triglycerides, that kind of thing. And also you'll be able to take that home with you. UK King's Daughters will also be here on February 24th with their heart bus. And they will be doing EKG screenings as well as biometric screenings. And so in February, we really want to encourage you to know your health numbers. Get those starting baseline down. And then after that, starting in March, we will start offering classes, which the library already is. They do refit and yoga. We will also plan to add on a walking challenge, as well as maybe some bingo size, other physical activity classes, and we, of course, will let you know as the days get closer. There's also going to be opportunities for nutrition education classes based on different chronic diseases, or if you just want to manage your own health. And then at the end of this program, we will recheck your numbers. So we will just see, what it looked like in the beginning compared to at the end, and how your health improved over that time. I really want to encourage you guys to just take charge of your health. Become educated in your numbers and, what you can do in your diet and lifestyle to make those better, or just keep them the same if they're, in good ranges. Another way that you can always take charge of your health is coming by to see me. I'm here at the Greenup County Health Department Monday to Thursday, 7:30 to 4:30, and on Fridays, 7:30 to 1. We do have a medical nutrition therapy program, and what that means is it's just one-on-one nutrition counseling, you and me. We talk about your personal health goals, your health journey, where you are, where you really want to be, and then, we talk about how you can get there and how, again, that journey looks different for everyone. So if you're interested, I encourage you to always call, or you can swing on by and see us. We love to see you. If you found this episode helpful, consider sharing it with someone who might need to hear it, especially someone who feels overwhelmed by health or wellness right now. And if you enjoy this podcast, make sure you're subscribed so you don't miss future episodes. We'll be talking about real, practical public health, what that looks like in Greenup County, and how it can fit into you and your family's life. You can also follow along on our social media pages for updates, resources, and upcoming programs here at the Health Department. The Greenup County Health Department, we actually have an app you can download on your phone, and we've got connections there and also on our website. Thank you for spending the time with me. I'm really glad that you're here and you're listening. Until next time, be kind to yourself and your body.